how can we learn from probiotics for brain health, for skin health, for digestive health, for metabolic health? We'll discuss in a moment vaginal health, and try to come up with sort of a meta protocol that summarizes the best use across all these different facets so that you can have one protocol that will have the highest yield for various symptoms, syndromes, and systems of your body. What is the best way to take probiotics regarding duration, dose, with or without food, and what specific formulas are the best? Let's discuss this today so that you know exactly how to use probiotics effectively. Why this is so important, probably fairly obvious. Probiotics are one of the most effective tools we have in the gut health arsenal. So using these correctly is something that we certainly want to pay a lot of time and attention to. So let's start our discussion off with a common question, which is how often should you take probiotics? And there's different theories here in terms of you shouldn't take them for too long. You should rotate from one probiotic to another. Too much probiotic can cause things like overgrowth, and you may even form a dependency. So let's look at this. And thankfully, there's one fairly interesting study, a meta-analysis, that summarized the available data to date and found that taking probiotics daily is adequate, ample, and efficacious. And what I would mention and like to keep in mind here is that while there might be all these theories in terms of what is best, most all probiotic research studies have people simply take probiotics once, maybe twice per day. There's not a more complicated protocol. And as we'll detail here in a moment, there's a very large body of data showing probiotics help with a wide array of conditions. So if we're seeing this very large body of data using mostly daily dosing, then rotation or other sort of more complicated, nuanced protocols probably aren't needed. And one of the concepts I'll keep tying us back to is simplicity is usually the most effective. So here, regarding frequency, daily seems to be the best way to go, and we can keep this one nice and simple. Are the data here perfect? No. Could we have more robust study of different protocols side by side? Maybe. Although if we're seeing, again, as we'll outline, multiple conditions from brain fog through bacterial overgrowth improve from daily dosing, that tells us that daily dosing is probably sufficient, and we don't have to make this any more complicated than that. Another question that comes up, and this is one that took me a while to get a good answer on, is should you take probiotics with or without food? And there are some theories here that acid in the stomach might kill the bacteria, the probiotic, therefore take it on an empty stomach, or that you should take probiotics with certain prebiotic foods to help them get down into the colon or the large intestine, or even that you may want to take an enteric-coated or acid-protected capsule of probiotic so as to allow the probiotic to make its way all the way into the large intestine and then open up there. And one of the things that some of these theories miss is a very seminal paper by Zorzella and colleagues who took heat-killed probiotics and assessed how effective they were. What they found was that killed probiotics were as effective as live probiotics. So the concept that we have to protect the probiotic from acid seems to become moot, one. And then two, to the question, the thought, the theory that we should use these enteric-coated probiotics, it misses literally most of your intestinal tract. Now, the large intestine is 5 feet in length. The small intestine is 22 feet in length. The small intestine absorbs 90 to 95% of calories and nutrients. It's where leaky gut occurs. It is where the most gut receptors occur or are housed, like toll-like receptor 4, which we've discussed in the past. It has the greatest density of immune cells and therefore is the most immunoactive. So we are really looking to get the impact of the probiotics in the small intestine. This is where not all, but I would argue most intestinal issues come from, again, given the fact that it is by far 4 times larger than the large, and ironically, than the large intestine. And it's vastly more intricate in terms of the immune expression, receptor density, and how this, of course, impacts things like food reactivity, IBS, and inflammation. So you don't need an enteric capsule to get to the large intestine because we want to have the impact in the small intestine. And there is one study here in particular that I found compelling. They divided the participants into taking probiotics with your meal or 30 minutes away from your meal, and they found no difference. I should also mention that the vast majority of trials do not tell people to take probiotics with or without food, and they do not use enteric-coated capsules. So since the body of data in probiotic research is not using particular dosing recommendations, with or without food, nor are they using special enteric-coated capsules, again, we come back to simplicity and come away with take your probiotic whenever works best for you. Focusing on being consistent is the most important. And this is one of the conversations we often have in our practice when we're consulting people. And people will ask, should it be in the morning, at night, with food, without food? And the answer is always, whatever is easiest for you, that is what you should do. So another point in the column for simplicity. Now, there's also this question of how long should you take probiotics for? And this was one area where, as we really probed deeper into some of the research, I had my opinions swayed slightly. The first study here that I found compelling was a meta-analysis of 43 randomized controlled trials, and they found that using probiotics for IBS symptoms was best when done for 2 to 3 months as compared to doing it for a shorter duration. Now, the IBS symptoms, you probably know these, but gas, bloating, abdominal pain, and then altered bowel function, whether it's diarrhea, constipation, or a mixture of the two. The paper that really perked me up was this one. It was a randomized controlled trial in constipated patients. They gave half of the individuals a placebo and the other half a probiotic. They tracked their constipation daily for 90 days, 3 months. And what this graph is showing you is that there was not a difference in the effect until day 60. And then at day 60, patients with constipation started to have improvements in their bowels. So this tells me that for constipation, 2 months or longer might be better. Now, why might this be? It could be that there's either dysbiosis or potentially methane small intestinal bacterial overgrowth, and it's taking a certain time to clear or reduce that overgrowth, thus stopping the cause of the constipation. And there are data showing, thankfully, that probiotics alone can remedy and eliminate methane type small intestinal bacterial overgrowth, and also other trials finding that probiotics are efficacious for constipation. So again, perhaps what we're seeing depicted in this graphic is the reason why you literally don't see better movement of your bowels until day 60, month 2, is because the probiotics need time to bring down the total methane gas load, which we know that methane gas directly slows down gastrointestinal motility and leads to constipation. Now, there's one other point here from this study I want to call your attention to. Essentially, there are 2 lines. An orange line is the probiotic group, and the blue line is the placebo group. What you're seeing is an up and to the right improvement trend where both lines overlap and intersect until day 60. Then the orange line, the probiotic group, has improved constipation above and beyond that of the placebo group. What this reminds us of is how crucially important the randomized controlled trial is to diminish the impact of placebo. Because if you give someone a sugar pill and tell them you're going to feel better from this, they will come back and say, yeah, I feel better. We have to look at that next to a group of people who are actually getting the intervention and see if the improvement in the intervention is in excess of that experienced by the placebo group. So just a nice visual portrayal of how important it is to have placebo-controlled evidence. We don't always have that luxury, but when we do, so important to look to it. Now, in our examination of probiotics, we want to be careful to have a broad perspective. We want to look at, well, how can we learn from probiotics for brain health, for skin health, for digestive health, for metabolic health, we'll discuss in a moment, vaginal health, and try to come up with sort of a meta protocol that summarizes the best use across all these different facets so that you can have one protocol that will have the highest yield for various symptoms, syndromes, and systems of your body. So we looked at liver health. And again, we see that 3 months or longer is optimal when trying to improve liver health, most namely fatty liver disease or non-alcoholic fatty liver disease. And what might be happening here is similar to the constipation study in that we know that treatment for SIBO can improve non-alcoholic fatty liver disease. There's a number of trials finding rifaximin, an antibiotic for SIBO, can improve non-alcoholic fatty liver disease. There's also some emerging data showing that probiotics can do the same thing. Now, how do these connect? Well, we know that everything in the gut drains via the portal vein to the liver. So if we're seeing that treatment of overgrowth in the intestine leads to improvement of liver health, that would suggest if you clean up a problem in the gut, less of that problem has to be drained and filtered by the liver. And as the constipation study at least suggests, you may not see the overgrowth or the dysbiosis in the gut improve in a week, 2 weeks, what have you. It may take a month or two until you get that overgrowth down to normative levels, and then you see a corresponding spillover benefit to, in this case, liver health. And similar to that, when looking at a meta-analysis for metabolic health, you see the same thing. You see that 3 months or longer is optimal for things like blood sugar and lipids. Now, I should also be careful to clarify that what's known as effect size, the magnitude of the impact for metabolism isn't huge. So yes, there is a statistically significant improvement in things like glucose and lipids, but I wouldn't say it's clinically meaningful, meaning as a consumer, you're not going to go, my goodness, my weight loss effect, another one of the parameters studied from this probiotic was awesome, and be elated with the results. There could be a couple pounds, there could be a few points, significant, but not necessarily, in my opinion, clinically meaningful. But nevertheless, for liver health and for metabolic health, again, we're seeing that around this 3-month mark is when we're having the optimal results achieved, probably because shifting the milieu in the gut, whether it's overgrowth, leaky gut, inflammation, food reactivity, takes some time. And as I alluded to a moment ago, the vaginal cavity is underneath the influence of vaginal pH. We know that as women get older, the likelihood of bacterial vaginosis or candidiasis goes up, in part because female hormones hold the vaginal pH or acidity in the optimal range. And as there's a skewing and diminishment of hormones with age, the pH becomes suboptimal, and that can open the door for overgrowth. This same thing can happen in younger women who are under stress, who aren't eating enough, who are eating a poor diet. A similar observation we're seeing here, which is that probiotics for 3 months was the most effective. So more and more data suggesting this trend of 2-3 months seems to be the optimal time point. And one other thing I just want to call your attention to, one type of probiotic, and we'll come to this in more detail in a moment, are known as lactic acid secreting bacteria. And that's what you're seeing here. You're seeing lactobacillus colonization, lactic acid. Acid will lower the pH, making the vaginal cavity more acidic, therefore less conducive to overgrowth. But the main point here regarding time is 3 months showcased yet again. So regarding the time, trial probiotics for 2 to 3 months and monitor your progress. Now, a couple other sort of user tips, if you will. In my observation, people will see improvements within the first month. That's different than saying you will see the optimal outcome within the first month. I think it's prudent to conclude that you're looking for some indication of improvement within the first 30 days. And if you're seeing improvement, keep going to see if you have a pinnacle or a peak of improvement at the 2 or 3 month mark. I mention this because while I've not felt well and I've wanted to get better as quickly as humanly possible, patience can be a virtue when you're trying to improve your health, meaning the fewest number of interventions is usually the best, but that requires some patience in that if you're seeing an intervention, namely probiotics, lead to improvements at the end of a month, and those improvements are continuing, give yourself another month and see where you apex. Then consider an additional therapeutic intervention. And again, I mention that because we don't want to overtreat. And I think because there's just a plethora of options available on the internet, people tend to what I call protocol jump, right? They get some improvement from the probiotic, but not full improvement. Let's say they're 5 weeks in and they jump to something else. Rather, you want to think about one thing at a time, get the maximum benefit from that. And then if you still need more benefit, my opinion here would be to then stack another therapeutic on top of that, rather than just jumping from one thing to another. So, healing requires time, not a ton of time, right? 1-3 months in this range, but just a note to be a little bit patient. And one of the components here that I want to tie in when we come to what dose is best is there are different formulas, and different formulas tend to have different dosing. Now, you've probably heard me say for a while that we can organize probiotics into 3 different types. We have those lactic acid forming that increase vaginal pH I mentioned a moment ago. So these are the blends of lactobacillus and bifidobacterium. This is the most traditional, most well-studied type of probiotic. And there are many formulas on the market. When you look at the label, you will see mostly lactobacillus and bifidobacterium. Sometimes you'll see B. Infantis or L. Acidophilus, right? So lactobacillus, acidophilus, bifidobacterium infantis. But this is your lactobifido blend. There's also entirely different from that a fungus, not even a bacteria, a fungus, Saccharomyces boulardii. And then thirdly, there are these soil-based probiotics, which are spore-forming, they're non-lactic acid-forming, and typically you'll see a bacillus species in these formulas. And this matters because they're used at different doses, so we have to understand the dose ranges that are most effective per formula type. Now, this is where the story, at least in my nerdy mind, gets interesting, because as we started looking into the best dosages for the lactobacillus and bifidobacterium type of probiotic, I was a little bit put back. The formula that we currently use has about 50 billion. And as we start going deeper and kind of re-reviewing the literature, which we often do in a cyclical fashion to make sure our understanding evolves and is current, for IBS, the optimal dose was clocking in around 10 billion. So I said, interesting. But we want to be careful not to have a protocol that's pigeonholed just to IBS. Remember our sort of meta protocol that we're looking for similarity across multiple conditions so that we can look for the best global recommendation. So we looked further into metabolic health for treatment of SIBO and brain health, just to name a few. And this is the data table that we comprised, looking again at IBS, at constipation, at blood sugar, at SIBO, at depression and anxiety. And what you see regarding the optimal dose range was anywhere between 1 to 10 billion colony-forming units. So this has led me to reappraise, and we're now taking steps to modify the dose of our lactobacillus bifidobacterium blend probiotic and our all-in-one triple therapy formula to adhere to this optimal range of 1 to 10 billion. Now, this covers the one type of probiotic. And by the way, this stool analogy we'll come to in more detail in a moment. But how I think about probiotics is, while similar, they're also a little bit different. And they seem to, in a very loose sense here, it's just a rough analogy, have different niches they support. Remember, the lactobacillus and bifidobacterium blend formulas are lactic acid forming, whereas the Saccharomyces boulardii is a fungus, and the soil-based probiotics are spore forming and do not produce lactic acid. So they are different definitionally. So let's now look at the optimum dosing for these other two types, because we've covered the lacto-bifido blends already. Now, there's not as much research here, and you'll see I have not used the term optimal because we do not know what the optimal range is. We only know what's been used in the research studies, and most of these studies do show benefit. However, they haven't gone as far as to determine what is the best dose. With the lactobacillus and bifidobacterium formulas, there is a larger body of data, and that data set has evolved to the point to which we can say this is the best dose. We are not there yet for the other two. You've probably heard me say that these are newer kids on the block. There's less research. I think ample research to use, definitely, but not enough yet to say what's optimal. So what you have here is an overview across a couple different conditions. Again, not as much research, and what dose ranges have been used and shown to be effective, but may not be optimal per se. And what you're seeing here for the soil-based probiotics is between 2 and 6 billion, and for the Saccharomyces fungus, anywhere between roughly 10 and 20 billion. So putting this all together, zooming way out, the recommendation for dosages sums to lacto-bifido blends at 1 to 10 billion per day, Saccharomyces boulardii or boulardii at 10 to 15 billion per day, and soil-based probiotics at 2 to 6 billion per day. And again, what we are now undertaking is modifying our formula line so that one dose will get you toward the lower half of the dose range, and 2 doses will get you toward the upper half of the dose range. And again, this is because as data changes or evolves, it's really important to me that we modify what we're doing and not rest on our laurels of a protocol that has worked very well, but there might be a better protocol out there. And this is why we use science. We use science to get better. I could very easily, if I wanted to, find 1 or 2 selective citations that supported what I used to do, but that would not be good for you. That would only be good for me. And that's really, hopefully, as you know, not how I want to operate. I want to evolve our protocols to be most accordant with the science and what is most efficacious. Okay, so then this comes to the question of what probiotics should you take in terms of the specific types. And this poses a couple other theories or hypotheses. There's arguments about which probiotic regarding the species or the formula or even the strain are the best. And with strain, this term is kind of thrown around as a loose colloquy, but Lactobacillus would be your genus, Acidophilus would be your species, and then the strain designation would be something like M23. So there was a recent meta-analysis published of 14 clinical trials looking at single strain versus multi-strain, and they found that multi-strain probiotics were more effective. Now, this is an area where there's a little bit of a split in the data, but the preponderance seems to lie in the direction of multi-strain probiotics being best as compared to single strain. Now, there's one exception there, which is the Saccharomyces boulardii, because that's typically given just as Saccharomyces boulardii. Sometimes Saccharomyces boulardii is combined with Saccharomyces cerevisiae, but I don't think there's really any need to combine both of those, although maybe that will be proven, and if so, we will evolve our formula. But when we're looking at formulas for which there's a good body of data comparing a single species strain compared to multiple, the trend line lays in the direction, at least via my interpretation, indicating that multiple are better than single. And if you think about this, we know that probiotics, all different species, they have subtly different effects in terms of the receptors they'll trigger in the gut, the types of antimicrobial peptides they'll secrete. So if we're trying to give the gut the broadest sort of support to get it back to balance, to reduce immune system overreactivity, to quell things like dysbiosis or overgrowth, At least in theory, it makes sense that a broad diversity of bacteria and fungi would be better than just one single. And again, that's where the trend in the data lies. This is not an incontestable statement, but I think the majority of the data point again in this direction. So that's for single versus multiple species or strains. What about different strains? Is a specific strain better or best? And this review paper found that there was no difference in effectiveness between different strains when comparing the same condition. So if someone has IBS, let's look at different strains and see if one strain is the best. And they did not find one was the best. This is, again, an area where the data are mixed, but the trend seems to continually lie in this direction of simplicity, meaning the specific species and the specific strain don't seem to matter. Rather, use a multi-strain intervention, and that seems to generally be the best. So my thoughts kind of in conclusion on this topic: strain specificity does not seem to matter. Multi-strain is effective. Don't overcomplicate which probiotic you use. And then the final point here, trial one probiotic. And if you want a stronger probiotic, trial the 3 different formulas. And let's go into the rationale of these 3 different formulas, because we've broken down there's different types and there's different dosages that are used across these 3 different types. But why use them together? Because that's a different question. So one backdrop I'll paint here is for treatment of H. pylori, we know that using 2 antibiotics is better than 1. With clarithromycin antibiotic monotherapy, there's about a 50% clearance rate. When you use 2 antibiotics in triple therapy, that's 2 antibiotics plus a PPI, now you have a 69% clearance rate. And also in SIBO, albeit this is one smaller observational trial, 2 antibiotics for methane SIBO clearly are better than 1 antibiotic for methane SIBO. And there's other conditions also for which multiple antibiotics or even multiple herbal antimicrobial interventions are better than 1 single formula. And that's really the premise from which we construct our heuristic or our recommendations for, okay, start with 1 formula. If that's working, but you'd still like more benefit, then add in the 2 others. And it really doesn't matter which one you start with. If you want it to be the most cost-effective, the cheapest is probably the soil-based type of formula. And for some people, that will be sufficient. Ride that to month 2 or month 3 and see where you pinnacle. However, if you're looking to have a stronger intervention, my and our clinical observation is that combining the 3 formulas together seems to be the most conducive to optimal health, well-being, and symptom resolution. Again, that's our speculation. Hasn't been demonstrated in the literature just yet, but that's what we're doing in the clinic. So the recommendation here, try a multi-strain probiotic and consider probiotic triple therapy, all 3, if you want a stronger intervention. And in summary, to hopefully tie all this together to a simple set of recommendations, take your probiotic daily. Take your probiotic whenever works best. Don't worry about with or without food, and don't worry about enteric coating. Take for 2 to 3 months. You'll likely see some symptomatic improvement within the first month, but keep going, as we covered earlier with the research in liver disease and metabolism and constipation and IBS, that the best results seem to occur around 2 or 3 months. You can start with a dose anywhere from 1 to 30 billion CFUs per day. There's a fairly broad range, and we gave you earlier the breakdown by formula type, depending on what formula you're going to start with. Try a multi-strain probiotic, and if you want a stronger formula, consider triple therapy. And the final point here is that your body is boss. Listen to your body. One other piece of advice I'll leave you with is when starting on a probiotic, there can be 1 or 2 tripwires waiting for you. One can be some transient turbulence. You might notice you're a little bit gassy, your bowels are loose, you might get a little bit constipated, you might feel a little bit tired, irritable, moody. That lasts, if it is an adjustment reaction, 3 to 7 days. Then it abates and someone starts to feel better. However, it's also possible that those negative reactions will last beyond a week. And if that happens, it tells us, or at least my interpretation and observation of this clinically, is that the probiotic that you're using doesn't sit well with your system, or at least not at this time point. That's why we also find the 3 different formula types are helpful. If you've used one and you're having that persistent negative reaction beyond a week, try one of the others. It's very likely that you will tolerate at least one of the 3. And then how you can sort of stair-step your way to optimal. Once you've hit your peak level improvement with whatever one formula you tolerate at maybe month 3, then trial again the other 2. And usually people have better tolerance. We know with probiotics, food tolerance will improve over time. Supplement tolerance seems to follow suit. So then trial the other probiotics again, one at a time, and see if you can now tolerate them. And oftentimes what happens is people can, and they see even more improvement over time. And in some cases, the only intervention on top of diet and lifestyle that they need to fully optimize their gut health is 1 or maybe 3 probiotics used diligently, and at that 3-month mark, or maybe a little bit longer, depending on what your on-ramp has been. So that is a run through of probiotics. A lot of time and attention went into this. I want you guys to know I really care about bringing you guys veracious and non-dogmatic information on all things, but especially on probiotics. And hopefully that's clear with the fact that we are going to be changing our recommendations in light of what some of the newer and emerging data is showing us regarding time use, but most importantly, with the optimum dose ranges, as we covered earlier. And I guess I'll just close with probiotics are, in a sad number of cases, overlooked. So if you're a clinician, please take some time to diligently advise your patients with, or your clients, on the use of probiotics. And if you're a consumer, be patient, use one formula at a time, take one step at a time, and remember that the 2 to 3 month mark may be where you want to get to before you really fully reappraise. You should see improvements along the way, but just a few notes there for you. And again, don't gloss over the importance of probiotics. They won't fix everything, but they are such a safe and well-studied therapy that can yield to, like we showed, improvements in gut health all the way through brain health, that this is one area that is really due to give quite a bit of time and attention to make sure that you do this right. So yeah, hopefully that helps and will help you on your path with using probiotics safely and effectively.